in the world to ensure that they review visa applications for those especially coming from coronavirus risk countries who wanted to come to Zambia. He also did remind us that travelers to Zambia through the airport as well as other entry points will be subjected to screening, which would result either in quarantine in a medical facility depending on the symptoms, and if there were no symptoms, then you'd be forced to be on self-quarantine in a safe place at your own cost. His Excellency also said from beginning to night, all bars, all clubs, all casinos, all gyms will be shut down. Restaurants will only offer a takeaway service as well as delivery. He also reminded us that according to the statutory instruments in place, we have to ensure that gatherings are limited, both in terms of time, but also in size, to about 50 people. And these are funerals, weddings, but I think that the rule of thumb is that if we can indeed avoid these gatherings, let us ensure to do that. His Excellency also informed the nation in his address yesterday that all essential travel must be stopped, was banned. Of course, there are some instances where travel might have to happen from government, but he did emphasize that all essential travel had been stopped, and all this is taking effect from midnight tonight. The last message from His Excellency in his address yesterday was a call to all of us as Zambians, as the community, to stand up and work together if we are going to succeed at this war of fighting the coronavirus. Yesterday, His Excellency in his address to the nation was informing us that the status in the country were 12 cases of coronavirus. Today, the Minister of Health is here in our continued effort as government to share information with you, and the Minister is now going to address the nation in giving us the latest status as far as the coronavirus is concerned. Minister, good afternoon.
Good afternoon, Honorable Minister. Good afternoon, members of the press, ladies and gentlemen. The Zambian government, under the stewardship of His Excellency Dr. Edgar Chagwa Lungu, keeps its eye firmly focused on universal health coverage. Health security remains a fundamental component of our health system strengthening agenda. To this effect, His Excellency President Lungu has ordered resilience in health systems even as we face the COVID-19 threat. He has directed the Ministry of Health to work with Cabinet Office to immediately commence engagement of health workers to ensure that we reinforce the fight against COVID-19. Distinguished ladies and gentlemen, allow me now to update the nation on the events of the last 24 hours. The number of laboratory confirmed COVID-19 cases in Zambia has risen to 16. We've recorded 4 new cases, and 3 cases have involved individuals with a history of travel to Pakistan, like the other 8 cases that were reviewed yesterday. And 1 case involved a citizen who is based in Luanshya, but was on the same flight from Dubai to Lusaka when they interacted with one of the passengers who came from Pakistan. To date, 471,417 cases have been recorded globally, with 21,295 deaths. In Africa, we have recorded 2,475 cases, including 64 deaths. Countries involved in Africa are 46. And close to home, the Democratic Republic of Congo has recorded 48 cases with 3 deaths. Tanzania, 12 cases, Mozambique, 3, Zimbabwe, 3 with 1 death, Namibia, 7, South Africa, 709, and the Kingdom of Eswatini, 5. Distinguished ladies and gentlemen, if we analyze the evolution of the epidemic in Zambia, we did record the first 2 cases that involved a family of 4 that traveled to France for a 10-day holiday. And when they came back, they were in self-quarantine. And upon follow-up, the husband did develop symptoms, and on testing was positive together with the wife, and they were admitted in our isolation facility. The 2 children remain negative to date. The 3rd case involved a Zambian who went to Pakistan and stayed there for 9 months, and on return did develop symptoms, and one of the neighbors did report to our Zambia National Public Health Institute, and we managed to move in, and we managed to test him positive, and he is still in our custody. The 4th case involved a Zambian again who traveled to Pakistan on March 9th and returned on March 18th. And when we followed up this case, we did discover that there were a number of people who traveled to Pakistan. And the number of people that traveled to Pakistan increased. We noticed that the number was much more than the number that we earlier thought. And in following up all these cases and their contacts, that's how we managed to track the 8 cases that added to the 4 to make it 12. The 4 cases that we are talking about today, again, 3 are related to the Pakistani trip, and also the 3rd one is related to being in contact with someone who traveled there. Distinguished ladies and gentlemen, we want to assure you that the multi-sectoral team that is involved in contact tracing, in surveillance, has escalated its interventions in line with the marching orders given by His Excellency President Edgar Chagwa Lungu, and are following up every contact associated with the cases that got into the country. Like I said earlier on, the 16th case is based in Rwansha, and we also know that one of the people that traveled back from Pakistan traveled to Petauke, and we are currently following up everybody. The 4 tests that came out positive yesterday were out of the 54 tests that we did yesterday. So out of 54 tests involving contacts of people who traveled to Pakistan, we managed to record 4 positive cases. We'd like to urge all Zambians to exhibit out maximal discipline in following the guidance that His Excellency President Lungu ordered yesterday, and ensure that at personal level we maintain hygiene and wash our hands and ensure that we adhere to all the guidance as alluded to by the President yesterday. Countrymen and women, let's take responsibility. Our public health officers will be in the community working with you, and wherever you are in doubt, engage them. Wherever you're in doubt, call the call centers. We also want to thank the cooperating partners who've continued working with us in ensuring that we have adequate PPEs and ensure that we have adequate materials to respond to this threat. Because of the collaboration with our partners, we've stockpiled materials for PPEs and are managing our patients in our isolation units well. As we speak, all the cases that were admitted to Levi Mwanawasa Medical University are very stable, and they are all recuperating well, and we have not recorded any deaths. I make a clarion call. Well, I'm emphasizing that the patients that were admitted to Levi Mwanawasa Medical University isolation wing are all recuperating well, and we have not recorded any deaths. As a matter of fact, we've discharged 3 from Levi Mwanawasa Medical University, and for those who were admitted to Tubalenge mini hospital in Chilanga, we've discharged 8. For our patients, for our citizens who traveled back on the flights where these suspects were on Emirates and Turkish Airlines on 18th of March, please continue getting in touch with us at the call center, and we want to appreciate you for the cooperation that you've rendered to us, including members of the public that have been very alert to report these cases. I want to assure you that the government of His Excellency President Edgar Chagwa Lungu will continue to implement measures to assure you of health security as part of its broad agenda for universal health coverage. I thank you.
Thank you. That was the statement on the update of coronavirus from Minister of Health. We'll now take some questions very, very quickly. Yes, please. Quick and to the point. We don't want to keep you here for too long.
My name is Brian from JMDC. I just want to find out if the whole government has put in place measures, some punitive measures for those who are deliberately going in the community, endangering other people's lives. We've heard of some people that were on self-quarantine, but have ended up mingling with the public, the case of APSA, which was closed yesterday. Thank you.
Statutory instrument number 22 empowers public health officers to enforce regulations under that public health statutory instrument to ensure that measures are put in place to protect the public from being infected. It is an offense to breach any provisions of statutory instrument number 21 and number 22. If you are under self-quarantine, observe the rules for self-quarantine, and we will be ensuring that enforcement is not negotiable.
I think for the members of the public, if you know people that are breaking the law, it's important that, as the minister said, you contact the authorities, Ministry of Health, and even the police are on standby, because this is a national issue and we want to keep all Zambians safe. Next question. Yes, behind there, my lady.
My name is Priscilla from Dagedi. We received information on 2 days ago that UTH tested positive to coronavirus after treating a patient who went for dental services. How true is that? And then also, what to find out, there's also information that one of the people who came from Pakistan got in touch with a driver from Tendere, and then he was positive, so the driver also tested positive. Were these people first allowed to go in the community, or what is the procedure from the airport to test?
Thank you.
Well, thank you very much indeed. Again, would like to appeal to the media that factfulness is fundamental in the fight against epidemics, and we are transparent as a government in the release of information, because there's no value in us hiding any information. There are no health workers reported yet to have acquired COVID-19. We do acknowledge that health workers are at high risk. As a matter of fact, there are many jurisdictions that have reported morbidity and mortality from COVID-19, and we have put in place measures to ensure that our frontline staff are protected from getting COVID-19, and we've not reported a single case of a frontliner getting COVID-19. When you get at the airport, when you travel back and you arrive at our airport, we will screen you for symptoms that suggest that you may have COVID-19, such as temperature. We will take a history to find out if you have the basic symptoms, such as a headache, flu, and so on, body weakness, and so on and so forth. And we'll also interrogate you if you've traveled, for us to determine whether you've traveled to a jurisdiction that is COVID high risk. Should we discover that you traveled to such a jurisdiction, we impose self-quarantine. And when we impose self-quarantine, we observe you for 14 days. Should we discover that in these 14 days you've developed symptoms, we will retrospectively look at who you came into contact with and investigate those and test them. So when you hear that there are some people who test positive as they came into contact with such individuals, it was in transit or as they got home into self-quarantine areas. So for those who are tested positive because they came into contact with people who have COVID-19, yes, we test them and also establish their contacts. So there's absolutely no breach in the quarantine rules, and it is important to note that it is the alert surveillance system that picks up such cases. We've picked out somebody in Luansha who just sat next to the 4th positive case on one of the airlines. Just getting back home, they sat next. When we discovered this case was positive, we looked at the contacts beginning from the people that sat next or in close proximity to this person on the flight. And when we discovered that one of them was actually based in Luansha, through our surveillance teams on the Copper Belt, we did swab the patient, the candidate, and we brought the sample and found out that it was positive. So that should give you the confidence that the surveillance system is functional and alert enough to pick up cases.
I think she had another question about the driver. Okay. Next question. Yes, my lady.
I'm Virginia from Movie TV. I wanted to find out from the minister. Just opposite across the road, we have the Old Victoria Hospital in the Zambia Airport's housing complex. As of last night, army tents were set up and hospital beds were put up. Is government intending to use that place as a quarantine area for COVID-19?
We want to thank the members of the public, the corporate world, who have come on board to support government in COVID-19 response. Yes, we are working with the private sector, and that is one of the facilities that was given to us to utilize in order to strengthen our response to COVID-19. As you are aware, we do not just admit those with severe cases, cases. We always admit even those with mild symptoms, and we need to isolate them, and so therefore we need a lot of space for us to keep patients with mild symptoms so that we leave the hospitals which are designated to manage severe cases less trained.
Next question. Is there one? Okay, we'll take the last question there.
My name is Prince Yohana.
Yes.
I wanted to find out and maybe a clarification on the 16 cases that have been recorded. All those in Lusaka, and then a church gathering is still going to continue, looking at the fact that cases continue to rise. And then lastly, if you can also, I would like to find out how many ventilators we have as a country. And there be also stories to say UTH has run out of testing. Maybe we need clarification on that.
Okay, maybe I'll take the question on the church gatherings. In his address yesterday, the president gave measures as guided by our health experts, and that is as of midnight tonight, all gatherings should be reduced to not more than 50 people. But you also recall that we also did advise that the advice of the health experts that church gatherings should be reduced to just 1 hour. The Ministry of Health and government in general has continued to inform the nation that the plan we have, the response we have, is a scalable response at any given time, depending on the situation. So we will wait to monitor the impact of the measures announced by His Excellency yesterday from midnight tonight. And if there is any need for government to pronounce further measures, we will get back to the nation and inform them. Let me also just point out that following His Excellency's address yesterday, I do know that Bishop Njofu of the Anglican Church has announced today that all Anglican churches will be closed. We also know that there are a number of other churches. I know the minister this morning was visited by members of the Catholic Church who are also considering whether they should even continue to meet for 1 hour. This is the response we are expecting from the public, working with government, not waiting even for government, but understanding and appreciating that the best way to fight this is personal responsibility. It's community responsibility. Minister.
Well, thank you very much indeed. Personal responsibility indeed Those who want to pray from home, please pray from home. And it's important to take personal responsibility for us to protect the next person. We have adequate test kits in the country, and we continue getting support from our various partners. And government also continues to invest in test kits, and therefore we are not challenged at the moment with issues of test kits. We have adequate ventilators strategically positioned in various parts of the country, and we are ready for the initial cases. And we continue to invest in equipment as part of our modernization program and also as part of the response. As you are aware, we have modern hospitals in Lusaka, at Levi, and at UTH, and we have adequate ventilators in Eastern Province at Kalindawalo Hospital. Chinsali equally has adequate ventilators to cater for Muchinga, and we have mapped the country to see how many ventilators we have and strategically position them to ensure that for cases that require ventilator support, we are able to hook them up.
I don't see any questions, but I think before I close, Minister, you have a small meeting with some people, I believe so.
Yes, yes.
Maybe if we can do this quickly so that the media can be released.
Thank you very much indeed. Like I said earlier on, we've had very good support from our cooperating partners and from the private sector. And today we have Huawei. And Huawei, could you come forward and do your presentation?
Yes. Yes. Can they sit there? It's convenient. Can they sit there? Then it's convenient.
Sit down and speak.
Okay. Ladies and gentlemen, good afternoon. Through this humble donation, Huawei wish to stand together with the government of the Republic of Zambia over the fighting for the spread of coronavirus, which has hit our beloved country. We commend government's continued efforts to intensify control and preventive measures. Huawei is the leading ICT solution provider in the world. We wish to support you through the donation of these equipments in form of intelligent temperature equipments for access control. This ICT access control solution can efficiently identify the target and detect the temperature and at distance meters with infrared contactless and avoid the high risks getting infected for the manual temperature measuring, so that it can perform fast, long distance and larger area checks. As we remain on high alarm against corona, we want to help everyone to equally do the same. Huawei is confident that these equipments will go a long way in improving the safety of everyone in the intended public work environment through also automated temperature detection. In our quest to bring digital to every one person, home and organization for a fully connected and intelligent world, we remain committed to supplementing government efforts in every way that we can do to the best to achieve our mission to techno for all. Zikomo, I thank you for all. Thank you.
Okay.
Yeah.
Well, thank you.
Thank you.
Thank you so much. Thank you.
Thank you. Okay.
Makora Investments Limited.
Good afternoon, everyone. We are from Makora Investment and Shan Carriers. We wish to join the rest of the Zambian people to fight this coronavirus. So we have come with a humble donation of 1,000 pieces of hand sanitizers, which will go a long way to help the community in fighting this virus. Thank you very much.
Thank you.
So this is the symbolic handover?
These are the samples.
All right, thank you so much. Thank you. Yeah. Upstairs.
I can always sanitize. Thank you.
Thank you.
Okay, ladies and gentlemen, I think we want to applaud the work that the Ministry of Health, with the leadership of the Minister at the Ministry of Health, are doing to ensure that we are all kept informed of the involvement of the coronavirus pandemic. Government also wishes to put on record the support to the private sector's witnessed this afternoon, also to our various cooperating partners who have come to the support of government very, very quickly. We are also very, very pleased with the support we are getting from the community, from the citizens yourselves, who are very eager to ensure that you work with government in terms of fighting this new war, the coronavirus. If you have a flu, you have a headache, you have temperature, you are coughing, please stay at home. It's our responsibility to keep our family safe, to keep our neighbors safe, to keep our community safe. As His Excellency President Kalungu calls to all of us yesterday.
Hygienics, you're safe in our hands.
Get ready to step it up with GoTV. Step up your entertainment with GoTV. How does this work?
You need to listen to me.
Pay your account now and we'll upgrade you to the next GoTV package. Don't wait. Pay now and step up to more for the whole family.
That's exactly what I want.
GoTV. Live it, love it.
I always look forward to Sunday lunch.
You're gonna need some Fruit Top to wash all that down.
And nobody does Sunday lunch like my mom.
Hey, Chris! Hey, Jack, come over!
Mom, can Jack come, please?
Wow, is that Fruit Top?
Nothing in this world is better than chilling at home with everyone. Woke up this morning with sunshine in my eyes, telling me everything will be fine. Doesn't matter where you're from, you cannot beat the taste of home.
And the thing I like about Sunday lunch is that everyone comes together.
Nothing brings a family together like a good meal and a great drink. Introducing Fruit Top, orange, pineapple, and granadilla fruit squash. Fruit Top, with the real fruit in every drop.
It's Easter promotion time again. The time for all families to own a Topster digital migration decoder has finally come. Enjoy an amazing 30% discount on Topster decoders this Easter period. Get yourself a DTT decoder for only 129 kwacha from 199 kwacha. Watch more than 100 channels by getting yourself a DTH combo decoder for only 299 kwacha from 399 kwacha. Both plus 1 month of free subscription. Hurry now and grab yourself a share of this massive discount gift and enjoy the greatest series, The General's Daughter, which premieres on 25th March at 2040 daily on Novella E+. And also enjoy exciting Star Life, Folks and Kids channels plus more. Get your family a Topster gift this Easter season. It never gets better than this. Topster, enjoy digital life.
This coronavirus update is brought to you in association with Hygienics Hygiene Soap. And if
of Health Headquarters, and you have been watching a live broadcast of an update on COVID-19 addressed by Dr. Chitalo Chilufya, who is the Minister in charge of health. So far, what we have been told from the press briefing, that the number of cases of those that have been affected by COVID-19 has gone up from 12 to 16 people now. 16 cases have been recorded. I'm now joined by Dr. Nathan Bachaita, who is World Health Organization representative, and just try to find out from him what this means. Good afternoon, Doc. You're live on Diamond TV News on the Go.
Thank you very much. What this means is that the number of cases in Zambia have increased. Most of them are imported cases, but we also have evidence of local transmission of cases that are connected to those who have traveled.
Right. Now, they have these measures that have been put across, by government. Maybe what could be your message to members of the public, even as they observe these restrictive measures?
On top of the preventive measures that have been we've been talking about all this time, like wash your hands frequently, physical distancing, coughing in the elbow or sneezing in the elbow, and also avoiding mass gatherings. These are additional public measures that the government has put in place, and my message to all is adhere to these messages. If you don't have any business going there, stay at home. Stay at home and only move when you have to.
All right. Now, we have seen, a sharp increase in terms of the cases. First, we had one case, and then we moved on to 12, and now we have 16 cases. Do you feel, these measures that have been put across actually yielding to results?
Well, if we go by what has happened in the other countries, there is evidence that these measures, the extreme measures as we call them, work. The point is that the fact that cases are going up means that our surveillance system has improved and is able to pick them up. All right? So the other thing, it also means that apart from just the numbers, it means that we have transmission going on, and therefore we must use every measure possible, all right, to protect our population. So government has assessed the situation and has come up with these measures. So my appeal to the public, adhere with what the authorities have said.
Right. Thank you so much, Dr. Bachaita, for having an interview with us on Diamond TV News on the Go.
Thank you so much.
Thank you. So there you have it. I have been speaking to World Health Organization representative Dr. Nathan Bachaita just to discuss this particular pandemic. And Zambia has recorded 16 cases of COVID-19. His message is that people should be able to adhere to the preventive measures that have been put across by the government. We'll be able to give you more update on this particular story. And you have been watching News on the Go with me, Darius Jr.
Coronavirus update was brought to you in association with Hygienix Hygiene Soap, an effective way to fight coronavirus. Hygienix, you're safe in our hands.
This is the taste of Africa.